Well, we always start by making sure that we confirm the diagnosis so that we've really done an accurate and thorough job to make sure that it's really ADD that we're looking at. And then based upon the medical literature, our extensive experience, if there is evidence of ADD and that's leading to dysfunction in people's life in some arena, whether that's school, work, peers, health maintenance, etc., then we feel medication is indicated. And then we do what we call medication trial tests. Based upon the profile from the initial evaluation, I pick the medication that I feel is most likely to have a positive response. We pick the lowest dose of that medication that we think could make a difference, and then we have the patient take a dose of the medicine wherever they're staying, and then 2 to 3 hours after they've taken it, come back into the office, and then we do actual objective testing of attention. And we compare that to the baseline testing that we did during the initial neurodevelopmental evaluation. So we have a way to compare the beginning to the response to the medication. And we might repeat that several times over the course of the 3 or 4 days until we find exactly the right medicine, exactly the right dose that we want to use once we start using it in the real world. Each one of those visits, we check blood pressure, heart rate, make other observations, and are there to support parents if there are any untoward side effects that seem to happen, to help them understand them and to feel comfortable that we're coming up with a solution for whatever those might happen to be. And then once people are on medication, then we always use the medicine in conjunction with counseling and other supportive services, never as the sole treatment just by itself. We provide ongoing support over time, where every 3 months we're reviewing and evaluating the efficacy of the medicine, whether the dose is still right, monitor for any kind of side effects to make sure that we don't need to do any adjustments, and fine-tune the medication as people grow and develop and need refinement. So there's 2 ways to do that. One would be to call directly to our offices and ask to speak with our intake coordinator, Sharon. Sharon would gather all of the basic information and take the steps to get the process rolling. The other is to go to our website and to the Contact Us page. And if you alert us, then Sharon or another representative from our team will get in touch with you as soon as possible to help get the ball rolling. And I'm excited to hear that you're interested. The sooner we get going, the quicker you start to experience change and success in your life.